Hello, everyone. My name is Mike Vinoy from Assure. We've got about a minute before the top of the hour. I just want to let you know if you're here for the webinar on the top 10 payroll and HR questions regarding COVID-19, you are in the right place. Stand by. We'll start at the top of the hour. Hello, everyone. We have 1 o'clock Central Time. I see we have several hundred people on, and it's ticking up by the second here. So I'm going to give it about 60 more seconds, and we will begin. All right, Tim. Okay, thank you, everybody. I want to make sure we are queued up to record this for all the people who couldn't make it today. We have several hundred people on. People are still popping on, but we're going to go ahead and get started to not keep anybody else waiting. So, but my name is Mike Vinoy. I'm the head of marketing at Assure, and I just really want to thank everybody. This is such an important topic. Obviously, the COVID-19 pandemic is impacting all of us, right? In many of us professionally, but also many of us very, very personally. So whether it means out of work, laying people off, family, friends, loved ones, about 40% of the country, so probably the majority of people on this call are in some type of stay-at-home shelter order. So these are crazy fluid times, and the goal of this webinar, zero sales pitch. This is 100% just to be a value-add resource to try to provide some information to try to help you guys. So you probably all have seen this slide or this image, some version of it, right? So this is the U.S. right now, and you know, the number of people impacted, you know, doubles about every 2.6, you know, approximately every 3 days. I think all of us probably know, we watch the news, read the headlines, this is going to get worse before it gets better. And if you know, it appears that, you know, New York City is kind of the epicenter of the world on this thing for now. But as it relates to today's webinar, if we go back a month, back to late February, you know, Washington was really kind of ground zero, at least for the U.S. on this thing, right? And so, you know, back in, it was February 29th in King County, the first patient died in the U.S. from COVID-19. And so there's about 2,400 cases up there right now. The reason I bring this up is because here is what King County looks like. So most of us probably on the call don't know what King County is. King County is essentially the greater Seattle area. And so if you look up here above Seattle, Kirkland, that's where that nursing home was that was so devastated and heavily impacted by the virus. Coincidentally, we have an office in Bellevue. So we got offices around all around the country. You got HR professionals, certified pros in all the time zones. But our biggest HR services team sits in the Bellevue office, right kind of at the epicenter here. And so because they've been receiving inbound calls from clients specific to the COVID breakout in that office for a month, they're really kind of a couple weeks ahead of most of the rest of the country, right? So some areas, this is just, the wave is just starting to hit. And so we assumed that the questions that our Washington team has been receiving for the last month really are questions that the rest of us probably have right about now or are about to have. And so we thought, hey, how do we get this information out? How do we share this with all you guys? And so that's really the function of today's webinar. So the speakers I just want to introduce so quickly: Drake Roth, he's an HR solution consultant in the Bellevue office, super smart, super talented guy. Mark Schultz, he's a SHRM certified professional. He's a certified PHRI, that's an international certification as a professional in HR. Nicole Young, she's got her law degree. She's the manager of compliance in the office there. So we have a team here with many years of experience. And what they've done is they've taken all of the thousands of calls that have come into that Bellevue office and sifted out the ones that are not state of Washington specific that would apply to the rest of us, and really just kind of stack ranked them and said, here are the most common questions that are going to apply to everybody, and let's put the question on the screen and let's just talk about it. Let's talk about what the answers and some of the nuances are. So that's really exactly what we're going to do. So real quick, I do want to set expectations for what's in and what's out of this webinar. So what's in, it is the top 10 questions that we've received that are, I would call them generalist payroll HR questions. And then however much time we have, we're going to be here for the full hour. We're going to go with just open Q&A. So go to the GoToMeeting, the GoToWebinar user interface that you logged in with and submit your questions there. We'll do our best to get it to as many as we can, and that's the focus. What's not in here, so last Wednesday night, Congress passed, President signed into law, the Families First Coronavirus Response Act, the FFCRA. We're not talking about that. That has a bunch of really very specific legal ramifications. We do have an article on our website. You can go to it. We'll circulate this deck that you can click on the link. It's not a biased article. It's not a sales pitch. It is quite literally, we're copying and pasting text right from the Department of Labor's website. So just sharing that with everybody on that site. So if you happen to be an Assure client that's on this call, you're going to hear directly from your account reps on specific guidance, using fields and codes for tracking, paid leave, FMLA, et cetera. And the only other thing, just a caveat at the bottom, we're doing this to try to be good humans. We're not selling anything, but we're also not, even though we have somebody with a law degree on the call, we're not your lawyer. This can't be construed as legal advice. These are some really smart, really talented, very experienced HR experts. Please take it as that. But we're offering up our very best help to help you in this incredibly unique, difficult time. So last thing I would say before we jump into it, to that end, we built a website that's for anybody. That doesn't matter if you're a client or not. We've tried to collect. I've got a page that is nothing but links to every single state and what their local government websites to manage COVID-19 indicate. We have best practices. How to kind of bulletproof and disaster-proof your payroll and HR functions. Like I said, we do have the DOL guidance on how to interpret the Family First Coronavirus Response Act, and also invites for webinars like this. We'll be having 1 or 2 webinars a week probably for the foreseeable future. So just to try to throw a bunch of resources at you guys to help. So with that, I'm going to turn this over to Drake, who is going to kind of help moderate with Mark and Nicole, and let's take us through what are the top 10 most common questions that you guys have been receiving for the last month. Drake, I'm going to give it to you.
Awesome. Thank you, Mike. Once again, my name is Drake Roth. I'm an HR solutions consultant at Assure Consulting. Some of you may remember me from last month if you attended our webinar. With me, I have Nicole Young and Mark Schultz. Mark Schultz is the manager of our HR team here. He oversees everyone who's been helping service clients around the Washington area. And I have Nicole Young, who is our compliance manager. I do want to give her a moment to speak very quickly. She has a very wide-ranging view and a perspective on this that is very unique, and I would like to give her a moment to share that. Nicole, go ahead.
All right, thanks, Drake. So just piggybacking off of what Mike and Drake said, we have a lot of participants today spanning across the US, and as our lawyer, I of course have to give disclaimers. We're going to be focusing on best practices for HR, and we're going to be touching on some federal laws. Unfortunately, we cannot get into particular state or local requirements, and so we ask, take everything we say with a grain of salt, and please consult your state and local requirements for some of these questions. I know that Mike said that we're not going to be doing a run through of the new Families First Act. I do want to say some of these answers do touch on aspects of that law, so I will be discussing where some of the answers do intersect with the law, but we cannot give a complete rundown of the law because it is very large and complex. So with that, I'll turn it back to Drake.
Awesome. So we'll just hop right into the questions here. So the first question that comes up, that has come up a lot, is should we as an employer require an employee not to come to work if they have mild symptoms and are considered not at risk for COVID-19?
So the answer to that question, Drake, is yes, to prevent the spread of illness in your workplace and among the general population. Now, what are the symptoms of coronavirus? We've heard it a number of times. I'm going to review them real quickly. It's difficulty breathing. It's usually a dry cough, fever, tiredness. One of the things about this issue is that it takes days for these symptoms to potentially even pop up, even if they show. So they could be very, very mild. Another problem that we have is we are now entering cold and flu. We've been in the middle of that. Also allergy season. So as you can imagine, the strain on the healthcare system has been quite pronounced. So what can you do as an employer? If you observe an employee experiencing these symptoms, we recommend that you send them home. And the reason for that is under OSHA, employers have a duty to maintain a safe and healthy workplace for all their employees. What do we recommend to do? At least 2 weeks or 3 days after the symptoms have resolved. So it could be a potential of a 17-day absence for that employee. Now, the EEOC has stated that it could pose a direct threat. Okay, maybe not. We don't know that. We're not going to get into that here in this one.
So
however, we do recommend. Sorry, go ahead.
Mark,
jump in.
If I jump in here, so one legal issue I want to talk about here is I could see some employers wondering, is this some form of discrimination? Or by asking someone to go home because they're sick, are we discriminating against them? So the law that you want to think of, and of course consult your local state laws, but the overarching law is the Americans with Disabilities Act. And if someone is experiencing, and the EEOC has explicitly said this, if someone is experiencing mild symptoms of coronavirus, if they have a fever or a cough, this in and of itself is not a disability. So you as an employer are permitted and empowered to ask your employees to go home because the ADA does not apply, and you also have that additional duty under OSHA to provide a safe working environment.
Great. So
thank you.
Yeah. I think we can move into our second question here. We want to make sure we give all of these the time that they really deserve. So our second question, so we have an employee that we sent home for, just exhibiting these mild symptoms. As an employer, how would I manage the time off options for this employee now that I've sent them home, or if it required them to take time off?
So if possible, we recommend offering a telecommuting option if that's available. If it's not available, employees can use PTO, versions of paid medical leave, depending on the state, because each state will have a different requirement potentially. Sometimes it's even down to the municipality that you as the employer are located in. Please be aware that what will qualify for paid medical leave, for example, in Washington State, quarantine does not qualify, but if an employee has symptoms, that would apply. Nicole has some other details on this one.
Yes, so adding on to that with our new Families First Act, and By the way, I want to mention, as I'm sure you all are aware, Families First Act applies to employers with fewer than 500 employees. So keep that in mind. But it is a federal law, and so it applies across the nation. So under this new law, employers are required to give emergency FMLA and emergency PSL under certain conditions. If you have a situation where an employee is experiencing mild symptoms, they could potentially qualify for emergency paid sick leave. It should also be noted that this law will not become effective until April 1st. But if an employee is experiencing coronavirus symptoms, they're entitled to up to 80 hours if they're a full-time employee of emergency paid sick leave if they're experiencing the symptoms and they're also making moves to get some sort of diagnosis from a healthcare provider. Now, whether that be they're calling the doctor and asking, can I come in? If they're waiting in the emergency room, if they're waiting in the hospital. If they are experiencing symptoms and they're actively seeking a diagnosis, they can take emergency paid sick leave.
Excellent. So let's move on to the third question here. So can I, as an employer, ask my employee to tell me if they are at high risk due to underlying medical complications, if they're high risk to COVID-19? Can I ask them about those underlying medical conditions that would put them at a high risk status?
So individuals with high risk generally have a history of things like asthma, diabetes, immune system disorders, heart disease, things like that. If you ask an employee if they are high risk for complications from COVID-19 due to that health condition, you're asking them if they have a disability. This type of inquiry is banned under the ADA. We do recommend allow all employees who experience COVID-19 symptoms to stay at home, which will benefit all employees, including those who may be increased risk of developing complications. If someone is experiencing symptoms or does experience symptoms, you can ask them to stay home, maintain contact with them to find out how they're doing, if they're receiving COVID-19 testing. You have an obligation to protect the rest of your workforce if they were exposed. Remember, you have a duty under OSHA to provide a safe workplace. Now, flip side, if an employee voluntarily discloses without a disability-related inquiry, he or she has a specific medical condition, disability that puts him or her at increased risk for complications, you have to keep that information confidential, just like you would for anything else that's confidential information. Okay, you can't just say, oh, well, hey, look, Mark's got this kind of stuff going on, so we're sending him home because of it. No, can't do that. Also, it's a really strong caution here. Do not assume that all disabilities increase the risk of COVID-19 complication. Many disabilities do not. For instance, if someone can't walk around as well, okay, that's a mobility disability, so be careful about that. What can you ask, though? You may ask this. This is not a disability-related inquiry. So fever and cough is not a disability in and of itself. Can you ask if they're having COVID-19 symptoms? Yes. And we addressed that a little bit earlier, if we observe it.
Excellent. So moving on to our fourth question here. Me as an employer, I need to reduce my hours, or I need to lay off some employees due to the economic strains of COVID-19. How should I go about handling this?
So this is one of those ones where you really need to tie in with your state and local laws. We can give you the federal overview. However, really, these are going to be state specific. Some of the things that can happen: reduction in hours. It could be known as the furloughs. There's anywhere, so what happens when we reduce hours? One of the issues that pops up is if you have an exempt employee. That is someone who is typically referred to as a salaried employee. You'll need to think about that because it's a difficult analysis, because typically the FLSA, which is the Fair Labor Standards Act, requires exempt employees be paid their regular salary if they produce any work or perform any work during that work week. So you have to take a look at that in particular. For hourly employees, you only need to pay them for hours worked. When you do place somebody on furlough, you should expect that they will not work, including checking email and voicemail. And I already mentioned about exempt employees. So you need to inform all your employees that work is not authorized during the furlough period without advance written approval. That should be a policy. You should also notify non-exempt employees that the same issue are generally entitled to compensation for hours when they are entitled to compensation for performing work when they are not in the office. It'd be great to get that in writing. Partial employment. Businesses who need to keep operating on a less than full-time basis can request status known as partial for their employees. Work search while on unemployment is waived if employees have been hired to work full-time, return at least 1 week full-time employment within a 4-month period. Again, that could be state specific, but generally these are federal guidelines.
Okay, so
there might,
oh, go ahead.
There are some also FFCRA considerations under this as well.
So one thing I want to add is, unemployment insurance programs are typically run through the state, and this is extremely complicated because we have a bunch of emergency rules being put into place in each state. The Families First Act did provide emergency unemployment funding to certain states if they comply with certain requirements, and as a result of that, we're going to see a huge influx of cash to these unemployment departments. And so they're going to be able to do things like extend out temporary layoff times, potentially provide more money for claims. So this is moving so quickly. I really recommend if you're dealing with a layoff situation that each state typically has a COVID-19 page, please consult that before taking any action. I just also want to touch on whether this is covered under the Families First Act. So the question that we have here is, the reduction or hours or layoff is due to the economic effects of COVID-19. Now, under the Families First Act, if a business needs to close because of a government quarantine or order, and the employee who is ordered to go home because of the order is unable to telework, that is covered by emergency PSL. However, it does not cover closure or reduction of hours for economic reasons. So just keep that in mind. It needs to be a government quarantine or order to isolate.
Thank you, Nicole. So moving on to our 5th question here. Can I ask for or require a doctor's note from an employee before I grant, these time off requests or any of these, paid leave allowances?
So the answer is sure, you could do that. However, given that we're in the middle of a pandemic, our healthcare system is really overloaded right now. So getting that documentation would be very difficult, potentially. Some doctors may still provide it. Most probably will not have the time to do so. So got to do it equally. Nicole, you've got some other input into this one?
Yeah, so first I want to say when you're thinking about this, you first need to think of, okay, what is this employee's time off being taken under? Are they using their regular PTO bank? Are they using some sort of state sick leave that is provided to them under the law? Are they using emergency PSL? The reason being, each type of time off has different requirements. So for example, in Washington, there's something called the paid sick leave law. 3rd consecutive absence, an employer may ask for a doctor's note. That's just one example. Now, seeing we are in a pandemic, as Mark said, we may need to provide more leeway to employees. I've heard about people just calling healthcare providers and potentially getting notes, after speaking to them. In-person diagnosis may be difficult for employees, and we need to contemplate that. One other thing I want to mention. One of the reasons you can take emergency paid sick leave under this Families First Act is if either you're experiencing symptoms and you're seeking a diagnosis, or you have an order from a healthcare provider asking you to quarantine yourself or isolate. So we should think of this as the classic doctor's note. If someone is experiencing symptoms, they seek the diagnosis, and then they get the diagnosis, presumably they will receive a doctor's note advising them to quarantine themselves for a stated period. And so you should receive a doctor's note in that way. And EPSL should cover that entire time period, from when they get the symptoms to while they're seeking the diagnosis to after they get the diagnosis and they have an order to quarantine themselves.
Thank you. So moving on to the 6th question, this is related in a way. So what if I have an employee that alleges that they contracted COVID-19 while at the workplace. How does that affect, workers' compensation? Can that be a compensable claim? What do I do?
Workers' compensation claims generally arise when an employee is injured on the job or contracts an illness under the job while they're working it. As applied to coronavirus, whether or not an employee can make a successful claim will depend on the nature of the work if the circumstances for the alleged infection fits these two cases, then is likely to be compensable as a claim. Illness or disease must be occupational, meaning it arose out of and was in the course of employment. Who would this typically apply to? Healthcare providers. They're on the front lines. Illness or disease, the second one, must arise out of or be caused by conditions peculiar to the work, creates a risk contracting the disease in a greater degree and a different manner than in the public generally. That's a very, very broad thing that's happening there. It'll come down to causation. Nicole, can you speak a little bit more to that, please?
Yeah. So typically workers' compensation claims are very clear. We usually see it, there's an injury. I was carrying these materials at work and I slipped and I broke my arm. For illnesses, it's more difficult to prove. Basically, you need to, if you're making a workers' compensation claim for coronavirus, you need to show that you contracted coronavirus in your workplace. And it's very difficult because, we're out and about living our lives as much as possible with these new shelter-in-place orders. But it's very difficult to say, I got coronavirus definitively at my workplace. Now, states have enacted some exceptions permitting healthcare workers to automatically qualify for workers' compensation if they contract coronavirus. The reason being, first, it's just a form to provide relief to these workers, but it can be presumed that if someone is working in healthcare, if they contract coronavirus, it occurred during the course and scope of their employment. They're exposed to so much coronavirus there.
Awesome. So we're going to move on to question 7. So I've made all these considerations for my employees coming in. I'm in a position where remote work is possible for my business. How does that affect the hourly rate or salary of my employees now that they're telecommuting?
You have to pay them the same amount as if you would if they were sitting in your workplace. That's under the FLSA. So you can't just change it because, Mark's working at home now. Well, he's not cleaning the front doorway anymore, so I'm going to dock him $1 per hour. No, you have to pay him the same amount of work. Now, could that change if the duties that Mark is performing, if that changes substantially? I'd be careful about that one because we're hoping that this pandemic is relatively short duration. We don't know that for sure yet. If it changes over a longer period of time, that's something to look at. And it doesn't matter where they're at, obviously. Now, how do you administer the pay for employees who are teleworking? First, if they're under a union collective bargaining agreement, a CBA, or some sort of a contract, you need to follow the terms and conditions of that agreement for pay. Typically, most employees aren't, so you need to follow the FLSA, the Fair Labor Standards Act, to determine your pay practices. And you have to pay at least the minimum wage for all hours worked in your location, and 1.5 times the regular rate of pay for hours worked in excess of 40 in a work week. Now, that may change due to state regs. For instance, California is different than Washington and other states. The rate of pay, again, shouldn't change based on whether telework is a reasonable accommodation. It's a bit of a red herring, so I'm going to let Nicole talk a little bit more about that part as well.
Well, it's very small, but let's say you have a situation where you're an essential business and you have an employee who comes to you and says, look, I've got this heart disease, and so I can't be here. And you say to that employee, okay, we're going to go through the interactive process. Heart disease would be considered a qualifying disability, and so a reasonable accommodation we could offer to you is to telework. If you're allowing that person to telework as a reasonable accommodation, it should not affect their rate of pay.
Great, thank you. So moving on to question 8. As an employer, I have all these employees who are taking PTO or sick leave. It's really affecting my business. Can I change the terms of my paid sick leave policy because it's seeing such heavy usage during this time period?
So federal equal employment opportunity laws do not prohibit employers from changing their paid sick leave policy if it is done in a manner that does not discriminate between employees because of some protected class. What are protected classes? Race, sex, age, 40 and over, color, religion, national origin, disability, or veteran status. Be sure to also consult your state and local laws. And Nicole's got some other information on this one. Please
Sure.
jump
So I think I just want to recommend everyone do not change any sort of policies retroactively. Also, especially if someone has already accrued paid sick leave, then I would not take that away from them. Now, if you can't afford to offer this to the employee and it would sink your business, the alternative would be a potential layoff situation and telling them, look, we can't afford to offer this to you, but you may be able to file for something like temporary unemployment. I just want to also offer a disclaimer. If your workforce does have a labor union and there's some sort of CBA governing sick leave policies, you need to follow that. Also, if you're changing your paid sick leave policy, you need to make sure that you are still in compliance with any sort of state or local laws.
Thank you. So, well, let's move on to question 9. Me, an employer, I'm a small business owner. I need to temporarily close or permanently close my place of business due to the effects of COVID-19. What rules do I need to keep in mind when I take this action?
This is it's an involved question because the FFCRA is really going to come into play here. And there's also could be local laws, state laws, things like that. So Nicole, do you have some insight as to what the FFCRA in a broad overview allows?
Yes, so let's walk through this together. Let's say that you are a non-essential business and there's been some sort of shelter-in-place order, and most of your workers are required to physically be present in your workplace in order to get work done. In that case, if you are covered under the Families First Act, you have fewer than 500 employees, your employees could qualify to receive emergency paid sick leave. Well, they can be part or full-time. That doesn't affect eligibility for emergency paid sick leave. They can get up to 80 hours if they're a full-time employee. If they're a part-time employee, you want to take a look at when determining, okay, how many hours should they be allotted in a 2-week period? You should take a look at their average hours over an average 2-week period. Unfortunately, we don't have more information on what that means exactly from the federal government. But for now, I would just take a look and say, okay, what does a typical work week look like for this part-time employee? And then offer them 2 weeks of those hours for emergency paid sick leave. Now, one thing I want to say is, let's say that you have a non-essential business and there's a government order for your business to close. Employees who are able to telework cannot receive emergency paid sick leave. If they're still working, they do not qualify for this type of leave. So keep that in mind. So that's in a nutshell how Families First could apply to this situation.
Great. So moving on to our last question, this kind of rolls everything up. What else can I do as an employer to, keep myself updated, to prepare myself, or to respond correctly to current conditions? What else can I do?
Number one, follow your local, city, state legislature for updates. And most states have an FAQ. They have a website already created to post these updates. Obviously, you're hearing in the news, on media and all that. I would really recommend not necessarily trusting what you see on Facebook a lot, because there's a lot of misinformation out there. Go to your local, state, federal resources, CDC, World Health Organization, your state Department of Health, Department of Labor, unemployment, employment security websites, things like that. There's FAQs, like I said, and it's a developing situation. So as Drake mentioned earlier, what's in place today may change by the end of the day today. So it's a fast-moving, developing situation. it gets complicated. So you have to sit back and think, okay, how does this interplay with, here's my policy, here's this, I've got this, how does all this work together? That's where a little bit of thought has to be taken to say, okay, this is how I'm going to manage that. Is it in compliance? Do some double checking there. The idea is, oh, sorry, go ahead, Nicole.
Oh no, I was just going to add one concrete thing that employers should look to right now. Obviously, the Families First Act was passed on Wednesday. Look out for regulations from the DOL on that law. I know that there's a lot of questions about, you know, how does this law work? What does a certain word mean in a law? Things of that nature. So wait for those regulations to come out. Additionally, I know in the Senate right now, there is a pending bill that's likely to be passed called the CARE Act, which would provide a huge amount of money to go directly in Americans' pockets, but also to small businesses. My understanding is that this money would be given to businesses with fewer than 500 employees and cover things such as payroll costs, employee salaries, rent, mortgage payments, other debts. So keep your eye on this particular act if it's passed, and look out for potentially applying for a loan through this program if it's pushed through.
Great.
Yeah, many states are oh, sorry.
Go ahead, Mark.
I just wanted to add really quickly. Many states are holding daily, weekly info sessions hosted by subject matter experts. We recommend attending those. And also, as you're dealing with your managers who are quite stressed because they're managing, they may be in a position where they've never managed a remote team before. Okay, how do I do that? What do I need to do? Communicate. Stay in touch and encourage them to say, hey, we need to work through this together. Let's be a team. And really, it's about managing your culture, your expectations. You still need to get the work done, possibly with a reduced staff, so that puts added pressure on everybody. Plus, we have all the stuff happening outside of the workplace that's all interplaying here, so stress level is very high. Take care of yourselves.
Just want to add on to that. So I've been participating in the Washington State presentations that have been going on the past 2 weeks. The Department of Health, the Small Business Association for Washington, they've been putting out numbers. They've been seeing upwards of a 500% increase in applicants during this time. So what that means is, you know, if things are manageable right now in this situation, make sure you understand what the requirements are for requesting all this aid, and have that information put together. The systems are burdened right now, and so you being prepared to apply for whatever may come up and have that information readily available will help you in the long run as these systems sort of modulate through this increased workload they're experiencing right now. So that ties up, you know, these top 10 questions. I understand for everyone here that it is a lot of information. There was, you know, maybe some terminology that you were unfamiliar with. There was maybe some you know, some term that you had never heard before that you're worried about applying to you. There's a lot of information right now. I would encourage everyone to check out the page on the Assure Software website, or reach out to resources. Please please reach out with any questions you have. Someone from Assure can give you an answer, or we can work through you with this. But I understand that there's a lot of information right now, and you know, we're all in this together trying to work through it and figure things out. We want to open it up now to a question and answer session. Mike Vanoy has some questions that have been submitted through the GoToWebinar app. Again, it's the application you logged into to get into this. We'll be taking questions from that application now.
Hey, thanks, Drake, Mark, Nicole. That really, really awesome. So appreciate your expertise. So here we go, guys. We have several hundred questions. We're never gonna get through all of them. I'm gonna do my best to prioritize. I want to just put a qualifying statement out there. A lot of the questions are very specific to the Families First Act. What I can tell you is there's a bunch of things most of us in this industry know. I can tell you that, you know, we sit on the board of the NPRC, that's the National Payroll Reporting Consortium, where companies like us, ADP, Paychex, others in this industry help to guide. So, you know, Congress passes laws, without, sometimes unintended consequences. So then organizations like the NPRC, we help then guide IRS and Department of Labor on how best to implement in an politically unbiased way, how best to actually implement those laws. So for the most part, I think most of the vendors, including us, have the how kind of figured out, but we are all awaiting a few clarifying remarks from IRS and DOL, which is why if you're happen to be an assured customer on the call, you're going to get documentation. I hope it's by Friday. Could be tomorrow. Worst case is probably Monday. Very specific guidance from whoever your current vendor is on the specific tracking codes and how you're going to track all these different types of leave types. But the guidance on what employers qualify and what employees qualify, that's pretty black and white. So you can find that on our website or directly from the Department of Labor. So I'm going to do my best to try to avoid some of those questions, some of those Family First Act questions, only because that is probably among the more fluid of situations. So with that, let's take the first one. Should we use the term furlough instead of laid off? Do the semantics matter? And if we use the term furlough, does that mean we need to cover benefits such as medical premiums for the next 3 months? Who wants to take that one?
I'll
start in. Oh, go ahead. Go ahead, Nicole.
Sorry, Mark.
We'll fight over it. No, just kidding. No, that's fine. Go ahead, please.
So, of course, I want to preface this by saying each state is going to have a different definition for these terms. However, as I've seen it, typically laid off means that the person qualifies for unemployment, which means that you are severing the employment relationship in some way. Now, term furlough, I've seen it used in many different contexts. And so I would say you need to be careful how you're using particular terms with employees, and they need to be geared towards the employee's particular situation. So let's say you have a worker who you're completely eliminating the job because, look, we don't need this position anymore. In that case, I would refer to it as a permanent layoff. If you have a situation where you may bring someone back at a later date, you may look into temporary layoff situations. Furlough can refer to a reduction in hours or a complete unpaid leave for an employee. So I would go ahead and just Google your state's local employment department and what they say about what furlough means for their unemployment system. And then getting the second portion of your question, whether or not benefits are covered are going to depend on what your particular plan is. So of course, I'm going to advise that you talk to your benefit broker. I have seen that, just based on everything that's going on, I have seen temporary layoffs and certain insurance companies are covering benefits just out of mercy to employees. But I have seen more often, if someone is laid off, they typically are covered under COBRA, and they get benefit extension through that program.
Generally speaking, what I've
go ahead.
Okay, so typically what I've seen, and this is a very general statement, furlough typically implies that, hey, we're going to put you on furlough for a certain period of time. Temporary layoff typically has some sort of an end date, maybe a little fuzzier out there. A layoff in general says, yeah, we're going to lay you off, but we may not have a specific date that you're going to return. So there has to be you have to be careful about the terms and how it's presented to the employee. And I think Nicole talked about that as well. So depending upon the term, depending upon what your state's rules are, what the definition is in your state, obviously go back to those websites and check those.
A little bit of a piggyback, and I think the answer is going to be it depends, but employers who have accrued vacation and sick time, does that matter full-time, whether they're laid off versus furloughed?
So I did see that this question was, I believe it was written from someone from California, and this really gets at, you need to pay attention to your state requirements. I know that in California, the rule is if you are terminating an employee, and I use termination to refer to voluntary termination, the person resigns, involuntary or a layoff, you have to pay out accrued paid time off in California. So that shouldn't change. If someone is laid off, they should receive their PTO payout in California. For other states, you need to check your requirements on whether you need to offer an employee's PTO bank after their employment has been terminated. I will say that if someone is, I've got this question a lot, if someone is given their PTO payout before receiving unemployment benefits, should that affect their unemployment application in any way? And I will say no, they can, because the employment relationship has ended, they can still qualify for unemployment. What it may affect is the amount of benefits that the person receives, because they will likely need to report the PTO payout to the state.
Another thing to remember about sick leave that may be state dependent, if you don't pay out the sick leave, and I'm talking about sick leave in particular, paid sick leave, whether it's a state law, local law, whatever, typically there's a requirement to keep it on the books for a certain period of time should that employee be rehired. So you have to pay attention to that one as well.
All right, so I said I was going to try to avoid the family first questions, but I think this is an important one. It certainly brushes up against it. And I can tell you that I know in my personal life, this is a question that I've gotten. If employees must quarantine, so they're in a shelter or under a shelter order prior to the 4/2, the April 2nd active date, and I would say, by the way, this 4/2 active date is a presumed date at this point. For the family's first effective date. So if employees must quarantine prior to the April 2nd active date and use PTO for compensation, is there any adjustment or reimbursement for the employee for the PTO used under the Act?
So I love this question because it gets at a lot of different issues.
And Nicole, I would ask,
yeah.
answer the specificity of the question if you could, but let's just talk broader, you know, what's happened to all these folks who have been under shelter orders for a week or so already, and they've got another week or two gap between that.
Yeah, what to do? That's a great question. So this can be handled in many different ways. First, before I dive in, I want to tell everyone, I believe everyone was, and myself included, was under the impression that this Families First Act would become effective on April 1st. There was a recently published frequently asked questions from the Department of Labor that actually clarifies that it's effective on the 1st. So that's just a heads up to everybody on that. But let's say you do have a situation where an employee cannot work, they aren't eligible to receive emergency paid sick leave or emergency FMLA, and they're quarantined. So the employee is free to use their PTO. They're also free to use, you to check and see if they have other sort of paid leave bank available. If the employee doesn't have any type of payment available to bridge the gap, you could potentially say to the employee, look, we can offer you sort of an unpaid leave until this new law kicks in, or if you'd like, you can apply for temporary unemployment for the time until the active date. So we would lay you off temporarily until we could bring you back and offer you these emergency forms of paid leave. One portion of the question says, is there any adjustment or reimbursement for the employee for the PTO used under the Act? So I want us all to think of emergency PSL and emergency FMLA as these new types of leave banks available. They're going to be in addition to PTO that's under your employment policy or paid sick leave that's under your employment policy. This is a completely different animal. Under the Act, regular PTO is not going to be reimbursed by the government. However, emergency paid sick leave and emergency FMLA is reimbursed dollar for dollar with certain tax credits. Mark, do you have anything you want to add to that?
Actually, that's a great explanation. I couldn't have said it any better.
All right, great. Thank you, Nicole. All right, I'm going to jump ahead a couple of questions. So our understanding is that for employers under 500 employees would be able to save, get some money back via deductions and payroll taxes. So there's a couple parts to the follow-up here. So how is the 500 employees measured? Is it the beginning of the pandemic? Is it annual, overall, prior pay period? What about full-time, part-time considerations? How is that going to be calculated?
Our understanding is that would be at the time the leave request is received. Nicole, please jump in here if you have further insights to that one. But that is our understanding, is that at the time that the leave request is received, then that's when you do the count.
Yes. So again, as a law nerd, I love these questions. So I want to get down into the weeds a little bit with you guys. So for both forms of leave, when we're thinking about timing, and this is important because a lot of employers are laying off people, and so employers may fluctuate above 500 and below 500. So the timing of the measurement is really important here. And the law says that you need to measure it at the time the employee needs the leave. So if you do have a situation where someone makes a leave request, but there's some delay between the request and the leave actually starting, you need to measure it at the time that the leave starts. Now getting into, okay, who constitutes an employee? How do we know who is an employee and who is not? It's going to depend on the particular leave being taken. So if someone is taking emergency FMLA leave, you need to take a look at who is on your payroll at the time the person needs leave. So this rule actually comes from our regular FMLA system. I've heard a lot of questions on, is someone who has been laid off considered an employee? And let's say it's a temporary layoff and there's an expectation that they're going to return. This is a gray area. My position is that you need to take a look, and the deciding factor is take a look at your payroll. Are they listed on payroll? And if not, which likely if they're on unemployment, they are not listed on your payroll unless they've had reduced hours. If they're not on your payroll, they shouldn't be counted towards the head count. Now, I want to give a disclaimer, of course, because this is a gray area and it's new. Normally, we have a ton of case law deciding these types of issues, but for this, it's, we're going off of what people's best guess is on the rule. And I want to get to, so we just discussed determining headcount for EFMLA. So looking to headcount for EPSL, you want to take a look, and the rules basically, they just say, do you employ fewer than 500 employees? Employ as used by EPSL refers to the FLSA definition, which is to suffer or permit to work. I've talked to colleagues about this, and my understanding is if someone has been completely laid off, if they're not working at all for you, they are not being suffered or permitted to work. And so I would not count them towards the 500 head count. Now, if they are receiving unemployment because they've had a reduction in hours, you are still permitting them to work, and so I would still count them towards the count for. So that was a lot of information. I would say wait till the regulations so we can see if there's confirmation on those. But that is my understanding at this time.
All right, thanks. Next question. I'm gonna skip that one. Forgive me, California. It's a California specific. I want to have questions for everybody. Can an employer reduce every employee's salary in the company saying it's this or layoffs? Meaning,
Now that is.
Can we do is say, hey, instead of doing layoffs, we're gonna do a shared sacrifice model? Talk through the impacts of that.
So that could be somewhat tricky depending upon state rules. However, you see that creativity come up a lot. It has been done. If you're going to do that, it needs to be carefully communicated to your employee group. So if, for instance, and we've seen some CEOs who have said, hey, you know what, I'm going to forego my salary during this pandemic. I'm still going to continue to work, but my salary to avoid layoffs. Okay, fine. If you're going to require that of your employees, you need to really carefully craft that communication. You need to get agreement with, this is what we recommend, get agreement in writing that, yes, okay, I'm going to take a temporary reduction in pay for X amount of time. Now, you have to be careful of a couple of things. One, there have been new exempt level salary level thresholds been published out at the beginning of the year. Typically, the salary to remain an exempt level employee has been raised in most states and is due to go up again at the end of the year. So you have to be careful about that to make sure that you meet the minimum threshold for the exempt level. For your non-exempt, your hourly employees, you have to be careful about getting below state minimum wage or even municipal minimum wage. So there's a lot of things to look at with that. Can it be done? Yes, but it has to be done carefully and it has to be done correctly, obviously. So give that a lot of thought before doing that. Is it a noble gesture? Yeah. Can it be done legally? Depends. Nicole, you got any more input into that one? Insight?
No, I, so long as you are, as Mark said, you are, if someone is exempt, you are still paying the salary threshold to them. I think that should be fine.
All right, we got a few minutes left here. I'm gonna try to come up for a little easier, maybe get out of the Family First Act specific questions. I know that's where everybody's head's at. It's where a lot of the specific application of the law is going to apply. But I see a lot of questions in here that my word's not there. Is that it's maybe some HIPAA exposure, right? So as an employer, do we need to notify staff if a coworker has symptoms or has been exposed or has even been diagnosed? What obligations do we have to our current staff versus privacy of that employee?
There's a couple ways
Yes.
that you can handle that. So Nicole, please go ahead.
Sorry, Mark.
That's all right. We're all HR nerds love that.
As you may all guess, we are doing this remotely, and so we cannot see each other. Before I get into this, I first want to clarify, there is, and I see this all the time, there is a myth that HIPAA is the golden medical privacy rule as it applies to employers. And this actually isn't true. HIPAA applies to healthcare providers only. The law that we want to be taking a look at, if you're not a healthcare provider and you're worried about, medical privacy of your employees, is actually the Americans with Disabilities Act. Under that law, you do have an obligation to keep employees' medical information private. There are exceptions. Let's say that you are going through a interactive process for a reasonable accommodation and you have to talk to the person's manager about their disability. That's fine. But typically, and it's a need to know basis, you should not be sharing employees' medical information. Now, this is an interesting dilemma because if one of your employees comes down with coronavirus, you are under an obligation under OSHA to keep a safe and healthy working environment. And so part of this entails that you should notify your staff members if there is a case of coronavirus in the office. Now, you need to just do this as vaguely as possible. So what I've been recommending is I would consult with your state Department of Health guidelines on exposure first. What I've been doing is I've been reviewing, because I'm in Washington, I've been reviewing the Washington Department of Health guidance on exposure. And it says, if you have been within 6 feet of an individual for over 10 minutes, you may have been exposed. And so I've been telling employers, if you think that someone has been exposed, you send them an email or you talk to them and you say, there has been a diagnosed case of coronavirus in this office. And based on Department of Health guidelines, I believe you may have been exposed. And you need to go also run through, I recommend you talk to your healthcare provider, stay home for 2 weeks, all of that as well. Now, I like referring to the Department of Health guidelines because I could see if you go to an employee and you just say, hey, heads up, you may have been exposed to coronavirus, you may get a follow-up question of, wait, what? How do you know? Who is it? If instead you say, based on this guidance, within 6 feet for 10 minutes, I believe you may have been exposed. However, I cannot go into details because I need to respect the privacy of the employee. Now, unfortunately, people may be able to figure out who has coronavirus, and there's nothing we can really do about it, but you really want to minimize the amount of exposure that you give to the person who has coronavirus.
All right, I'm going to squeak one last question. I got 2 minutes left in our hour. I'm going to ask a question that requires about a 30-minute response, but it's classic HR, super legal and nuanced. If we have an employee who needs to be home due to childcare closures, and they're unable to work their full hours remotely, how are they compensated for the difference? Is the employer still responsible for paying them the normal hours, or are hourly, or if they're an hourly employee, how do they just not get paid for the difference, or do they have to use PTO? Good luck with that one in 1 minute, Mark.
Okay, so the FLSA requires that if you're a non-exempt employee, you pay for hours actually worked. So if you're an hourly employee and you work, you generally have a full work schedule, and now you're suddenly only able to work 20 hours a week, the obligation is to pay for hours actually worked.
And Mark, what if it's a salaried employee?
So that becomes a little trickier because, again, if the FLSA requires that if it's an exempt employee, you have to pay their regular salary if they perform any work at all during the work week. Technically, if that exempt employee gets online, checks email for just 30 seconds, guess what? Under the law, technically, if you really want to go that far, you have to pay them their full salary. Now, if you come up with some sort of arrangement, as discussed earlier, where, hey, we're going to reduce hours, we're going to reduce salary, we want to enter into this agreement, that may be an option, but you have to really think that through carefully and make sure, and you may even need to involve legal counsel in making sure you're doing it correctly.
All right, Mark, Nicole, Drake, I really appreciate it. We have so many really great questions left in here. I'm chatting with a colleague here. I'm thinking maybe we have another one of these in a few days next week where we take the top 10 questions that were unanswered from this webinar. Everyone, our thoughts and prayers. I don't mean that in a trite, overused way. Really, we're concerned for all of you guys. We're concerned for America. We're concerned for the world, and just hope everyone stays safe. We're going to get through this. We don't know what the next 60 days, 30, 60 days hold, but we do know that this is going to be temporary. We're going to get through it. So hop on the website, assuresoftware.com/COVID-19 for a bunch of resources, and look for future communications and ways we can help. Thank you, everybody, for attending.